So let me give the quick definition, or one of the definitions. Behavioral health phenomenon that has behaviors such as self-doubt of skills, thoughts, and solutions. That's just one of the tiny imposter syndrome definitions.
When I think about it, truly, it's, we are, very confident women who are, we know who we are. We know, we are about our craft that we have been God-given, right? But then when you enter spaces, in certain spaces, then suddenly it's almost as if, others really make this imposter syndrome a thing, right? Because you're good at what you do, and yet the doubt comes because others are doubting you.
Right.
And then suddenly, you're like, well, I thought I knew, and then, but maybe. And I'll give an example, me coming in as I've been here, like I said, 4 years now, but me coming in as a new interventional pulmonologist, and, people didn't even know what that meant. People didn't know what skill set I had to offer. Right. And so they just saw me, I show up, I suppose I'm young looking. They hear that I'm recently out of fellowship, and they say, Great. That's great what you do. But, did you call a surgeon and talk to that surgeon about what you're planning on doing before you do it? And this was things that were said to me. And I said, well, no, I intend to do this. I intend to handle these airway things, these airway emergencies, these airway blockages, because that is my skill set. That is my craft. And yet to be I guess, what's the word I'm looking for?
Doubted?
Questioned.
Yeah.
To be affirmed, I needed a surgeon, or I needed a male, or someone who did not look or sound or whatever like me. I wasn't enough is what it was. And so that imposter syndrome really wasn't how I felt about myself, because I know what I can do. I just do. But it really truly was, this idea of having to prove that to others before they could see me and really truly see me.
Yeah. What do you think?
Yeah, I mean, I read a quote somewhere that 70% of female CEOs suffer from symptoms of imposter syndrome, and that to me was kind of not surprising. I mean, I think we as professional women that have been through a lot of training, that know our skill set, still sometimes doubt ourselves.
Yeah.
And we're all talking about mom guilt and how we doubt our abilities to sometimes provide what's best for our kids. Do the same thing at work.
Yeah.
And I think that it's something that affects everybody, not just women, but in any field, but particularly, in fields like what we're in, because we get doubted sometimes by patients, and then that makes us internally doubt ourselves. Well, maybe I'm not good enough to do this. And I think the further along we get, it lessens because we become more confident in our skill set, but it continues to happen. If there's things that I'm not as familiar with, I'm like, well, I shouldn't be the one that's dealing with this. I should probably call somebody else. But I think that recognizing it, teaching ourselves how to better overcome these feelings will only help us in the long run.
Yeah, totally agree. I I think it's really a good way that you framed it was it's not necessarily something that comes internally. It's external pressure. So I'm sure that the root is there internally, but external situations and external experiences is what reinforces that in your mind. Because I have gone through this, I don't know how many different times in different ways. And that's why I think that mentorship is so important for upcoming training physicians, because if you have a connection with someone that's walked that walk, it can really save you time and energy, but also affirm you, and as far as validating your feelings and then helping you navigate these situations, because this can really affect your mental well-being and your own health if you're doubting your skills, and can affect patient care. If you know that you're good at something but someone questions you, you're like, really, am I that good, or am I okay? And it's not that you're afraid to call for help when you need to. It's just, this isn't my wheelhouse, I know how to do this, but someone doubted me, and then I start to doubt myself a little bit more. So
I think this comes back into why, diversity, equity, and inclusion, though, is so important. As far as being present, us being within the medical field, right? And now making a path for others to see us and hear us and see and feel our presence here. And with that then brings, the next generation of doctors, well, because they've seen Dr. April McDonald doing this, not be doubted in so many ways, or because they've seen Betsy Grunch being the neurosurgeon, like the next neurosurgeon who comes behind you, maybe they won't have to go through those same experiences that you may have had to. So
yeah, I think, it goes both ways too, because if you are different, you're looked at differently, and you almost have to kind of step it up a notch. You want to make those good impressions. I was talking with some colleagues at a meeting recently. It was a spine surgery meeting, and it was the first, just 2023, and it was the first women in spine meeting at our national conference, Wild. So we got together as a group, we had a Q&A, and one of them mentioned something. They said that they were the first female surgeon in their spine fellowship that had been in a while, and the reason was they had a woman a few years ago, and she was not good, so therefore they weren't going to take any more women. Whoa. And it made me think, it's like, okay, well, maybe that particular person wasn't a good doctor. That had nothing to do with her being a woman, but they were looked at differently, and then they modeled their application process around that. And so I think it's something just that we all kind of harbor these expectations of and looked at a little differently because we are different. And anyway,
what can we do, the three of us as women physicians, to change the trajectory of the pipelines? Because you talked about specifically how you may or may not, or likely are the first, African-American interventional pulmonologist in the country. Like, that's wild.
That is wild.
That's why I will not tote it, because I'm just waiting to meet someone else who must have come before me, right? Yeah. Again, we're talking 2018.
Yeah.
So
what can we do? What can we do to further this discussion, this cause? First thought.
It's mentorship, I think.
Advocacy. I like that.
Yeah.
I like that.
Yeah. We just have to strive to include all of those that are behind us. We're not doing anything. I don't feel like I'm doing anything uniquely different than the next guy next to me. It's just because I'm different doesn't make me different, but I have to be able to, like I said, you are looked at differently, and I want people like us to continue to feel like they're included. And just that could be something as simple as saying, hey, Mrs. future doctor or whatever medical student, come spend a day with me in clinic. Let's see what it's like. Just include them, or the nursing student. Why do you think I'm doing this procedure? What are your thoughts on it? Let's talk about it. And just, kind of just growing our tribe.
Yeah.
That inclusivity, I think, makes a difference, and you just never know truly. It may seem like such a small thing for us to do, because, we do this all day long, but you just never know, like, that spark or that interaction or just being there and present, how that impacts someone's trajectory and their course for their life. So I agree with that.
Yeah. Inclusion, I think that's huge. And you've all probably had this experience where someone comes up to you, like, Dr. Rojas, I remember 5 years ago when you said to me this, and you're like, I don't even know what that is.
Yeah.
But they remember that moment.
Yes.
That's very true.
And it stuck with them. And, every little thing we do along the way, just saying hi to somebody, really can make a difference. That's why I try to put your A game on when you can. So you can't always, but,
Yeah. I think that by the first thing we can do is by furthering these, like having these discussions and having these conversations, because we may not have solutions, but we're at least putting things out so that people understand, you know, there's a problem. There's some opportunities to improve. We may not know what that looks like, but we have at least acknowledged that there is something that needs to be worked on. And that's one of the reasons why I'm so excited to continue these podcasts on diversity, equity, and inclusion, because NGHS has been committed for decades to bettering our community. It's part of our mission statement is improving the health of the community in all that we do. And so by supporting this podcast is one way that the health system is really, you know, being a part of the solutions. And so I'm very, very proud and fortunate for that. I wanted to just highlight to the audience a few things that NGHS does in the way of diversity, equity, and inclusion. So outside of this podcast, we do have a physician diversity, equity, inclusion task force that is supported by our CEO and our COO. Within the graduate medical education department, we have a director for diversity, equity, inclusion, which is myself. We have councils and support from our wellness director and employee assistance services to help address and make sure that we're not only taking care of the physical physician and our trainees, but actually the mental health of our employees and our training physicians as well. And that's within GME and outside of GME. We have actually medical research that's going on within diversity, equity, inclusion. And just this past year, there have been two or three grants that have been accepted or received, and then some of that research has been presented at national conferences just this year, which is super, super exciting. So these are just some of the things that we're doing. We're looking at internal and external mentorships so that we can create and nourish the talent pipeline so that we are creating more opportunities for everyone to have a seat at the table. And just to reiterate that, again, diversity, equity, inclusion is not a race issue. It's not just a gender issue. It's not just a religious issue. It's all of these that are under this umbrella. And throughout this podcast, we're going to go through so many more different topics. We're going to go through topics. We're talking about, like I said, ageism, LGBTQ. We're going to have, hopefully, our physician leader who has spearheaded a lot of our patient care initiatives with our gender clinic. So there's so much that the organization is doing around this, and this podcast is just one way to, let everyone know what we're doing, and then really be a part of the dialogue for solutions for, furthering all the things that we're talking about. Well, we have had such a great time. I want to thank Dr. McDonald and Dr. Grunch for joining me yet again. And, please drop in the comments things that you want to hear, topics you would like to hear about, because we would love to interact with you. Thanks.